A lot of people reading into that, but no reading into these thunderstorms like yesterday. Can they really create breathing problems for those of you with sleep apnea, asthma, or maybe even emphysema? There was a 2010 Harvard study that raised this possibility, so we decided to ask Dr. Joseph Ogile of the Clayton Sleep Clinic to come in and discuss what he's discovered over the years. Good morning to you.
Good morning, John. Thanks for having me.
Did you sleep well through the storms?
I did sleep well.
Yeah.
But this is a very timely issue. Clinically, we've seen for many years, and we actually have brochures we give patients who have asthma and COPD, which is emphysema and chronic bronchitis. They do notice significant changes in their breathing when these storms roll in. As the barometric pressure appears to drop, and when it drops rapidly, they will notice that they have more difficulty breathing. They'll have what we call exacerbations or flares of their asthma and emphysema and shortness of breath. So it's great to have the ability to have that conversation. It's unknown exactly why it occurs. It clearly does occur.
But it is a scientific fact.
It is. Actually, the American Lung Association has brochures for people with emphysema to talk to them and let them know that this could happen. Some people think it's related to the strong downdrafts causing increases in pollen and molds and spores and things.
Right, that brings the warm air brings the pollen and spores up into the air, and then they drop down with the rain and everything else. And I've heard that explanation, but the low barometric pressure also brings to mind some questions. Is this dangerous?
If you have severe lung disease, so if you have sort of difficult to control asthma, or you have significant emphysema, it can cause you to get sick enough to either call your doctor, see your doctor, or go to the emergency room. We try to warn and educate our patients concerning it and get them prepared for it, and also to let them know that it's real. We like to tell our folks that the rheumatologists and orthopedics don't have the market cornered on their patients telling them, I know the weather's going to change because my knee hurts. Mm-hmm. Our breathing patients and some of our sleep patients can tell this as well.
So just be aware of it. Watch Glenn or Angela with the weather, and you have a good indication of what's coming up.
Exactly.
And you can prepare.
And know that it might happen. There is some evidence that people's sleep apnea is worse when these storms come in. It's unclear why that is. It could be that as the barometric pressure drops, it allows the pharynx or the back of the throat to collapse a little bit easier. That has been seen in several Harvard studies, but the reason for it's unclear.
All right. Dr. Ogile from the Clayton Sleep Institute.
Thank you.
Thanks for coming in. We
Thank
appreciate
you.
it. Randy, there you know.
Sounds really familiar in my house, for sure.